Hi guys, how are you doing? So I hope you're fine. So what we're gonna do today, I'm just going to demonstrate on how we can run a SpeedBiogram. Okay, so this is a SpeedBiogram. Okay, SpeedBiogram. So what we can do here, we have four bottles. Okay, so this is paraffin oil. The words are not clear, but I can describe to you. This is paraffin oil. This one is a preservative media. This one is a culture media. This one is a staphylococcus supplement. And then this one is our gallery, as you can see. Okay, this is our gallery. This is where we put our sample after running it. Okay, so what we do, this is our sample. Okay, so this is our sample. So what we do, we will first use the preservative. Okay, so we'll first get the sample, our sample, and we put it in the preservative media. Okay, then we put to the culture media, and then we can put I'll show you in a second. Okay, so what we do, you get your sample. This is our sample. It's a urine sample. So this sample was collected by cystosynthesis, but you see it's a little bit cloudy. So what we do, you get this first bottle, the one which is preservative. So preservative first. Okay, you put 3 drops. Okay, so this is 1, 2, and then 3. Okay, 3 drops. And then after, you shake vigorously. Okay, you shake vigorously. So after shaking vigorously, so you get this sample, the one we have shaken vigorously, and then you put 4 drops in you put 4 drops in the culture. Yeah, this is the culture media. So green first, yellow second. Okay, so you put 4 drops. Okay, 1, 2, 3, 4. Okay, so this one, now it has no use, you can throw. Okay, so after putting in the culture media, you again shake vigorously. So what next? You open your SpeedBiogram. Okay, you open your SpeedBiogram, but remember, when you're trying to open it, remember we still have these 2 bottles. So when you try to open it, you make sure that you don't mess up. Okay, so after shaking, as you can see, so this is our well. Okay, so after shaking, we'll put each well will put 3 drops in each well. In each well you're seeing, we'll put 3 drops. Okay, so the cover was covering like this, so I removed it and then I brought it back, so it's like this, so I don't be confused. Okay, So I'll start putting my 3 drops. Okay, so I'll start from this one. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so after putting our 3 drops, this one also you throw, it has no use now. So you go to the Staphylococcus wall. The Staphylococcus wall, it is this wall you're seeing here, the one you're seeing in the middle here, I mean on the extreme edge, my left. Okay, so what you do, you put only 2 drops in only the Staphylococcus wall, only 2 drops. Okay, 1, 2, only that. And then for this paraffin oil, we will put in every well apart from the Staphylococcus, the Pseudomonas, and the E. coli. Okay, we will put 2 drops. Okay, so what we do, apart from these 3, okay, so 1, 2, 1, 2. Okay, so our sample is ready, and then we can run it for our days. Okay, thank you very much. So hi guys, I'm here to interpret this SpeedBiogram for you. Okay, as you know, we ran a certain sample yesterday, so today it's 24 hours after the finals, after we set our sample for incubation. Okay, so you can see clearly that you see here, this is the positive well. Okay, yeah, this is the positive well. So it develops red streaks. If you can see, it is different from this. This is clear solution, and here there is development of red streaks in it. So that means our sample, all our sample we put is positive. Okay, so this one is a column for antibiotics. Okay, this is a column for antibiotics until here, until this part. Okay, so this is all antibiotics. Okay, and then this one here, these are the bacteria present in this sample. Okay, so let's attempt one by one. Okay, I'll try to do like this, maybe you can see very well. Okay, so our sample is already positive. Okay, is already positive. So this sample, it has bacteria. So the bacteria which is present, we have to go and check for the side of the bacteria, and then we find out which kind of bacteria is present. So far, the bacteria we have the Marassia, we have the Proteus, we have the Enterobacter, we have the Streptococci, we have the Staphylococci, we have the Pseudomonas, and the E. coli. Okay, But in this case, after 24 hours, the malassezia, you see, the malassezia is positive, so it turned out to be gray in color. You can see it is gray in color. And then if we go to the next one, that is Proteus. Okay, if you go to the next one, that is Proteus. Proteus, it is negative. Okay, it is negative because the color stays still the same, so nothing, there is nothing that has changed at all. I mean, there is nothing that has changed. We go to Enterobacter. Enterobacter color changed, so Enterobacter we are seeing yellow. You can see we are seeing yellow. You can see this is yellow. Okay, yellow in color, so that means Enterobacter bacteria, okay, is present. Okay, so this sample has Enterobacter. We go to Streptococci. Streptococci is negative because it's still colorless. Okay, and then we go to Staphylococci. Okay, Staphylococcus is also negative. This color is okay. So when we go to the Pseudomonas, Pseudomonas is strong positive. You see color turned to blue. Okay, color turned out to blue. And if we go to the E. coli, also the E. coli, the same. It is also having blue. You can see blue color on the meniscus. On top, you can see on top blue. So this sample is positive for Pseudomonas, E. coli, Enterobacter, and Malassezia. So we have 1, 2, 3, and 4 bacteria present. So this bacteria is present. We are going to this bacteria is present. We are going to see to check out which medicine we can use to treat this problem, this bacteria. So this bacteria, we come to the antibiotic side. So the first antibiotic is called amoxicillin, whereby amoxicillin, it also has red streaks. You can see red. It has that means this this patient, even if you treat with amoxicillin, is not going to heal. It's because the the bacteria present in the body of the patient is resistant to amoxicillin. Okay, so amoxicillin is eliminated in our prescription list. The same applies to amoxicillin clavulanic acid. We are not going also to treat with this one because there is also red streaks. That means the bacteria is resistant to this medicine. Also we go to ceftriaxone, cephalexin. Cephalexin is also the same story. Ceftriaxone is also the same story. Doxytetracycline, the same story. Fulmaxin, the same story. Enlofloxacin, the same story. Mabofloxacin, the same story. Okay, so that means all this line of antibiotics, it is resistant. So I don't know what to do. We go this side. Again, you can see this antibiotic spermicin is also resistant. Also clindamycin is resistant. We go to neomycin. Neomycin is sensitive, so that means our patient, we can treat with neomycin and this problem can heal. Gentamicin is also sensitive. Sulfonamides are also sensitive. This one is resistant. Okay, so this one we will not use in our protocol. Also this one we will not use in our protocol. So that means the only medicines we have to treat this condition, because this client has infection, has a very long recurring urinary infection. Okay, so that means we have an option of neomycin, gentamicin, sulfonamides, and also the PXB medicine antibiotic. Okay, so I think you understand very well. So we only have the solution. Okay, thank you so much for watching with me. Thank you very much. I stand as Dr.